Good morning. Hope your Wednesday is off to a fantastic start. Looks to be another beautiful day in the neighborhood, as Mr. Rogers would have said. And I hope you'll have a chance to get out and enjoy the day. But for now, I'm awfully glad that you are inside watching 3+U. So much of our conversation has changed in the last several weeks. The kids are out of school now, officially enjoying summer. Perhaps you and your family are making plans for a summer trip or just some day trips to get out there and enjoy the freedom that the summertime brings. But for very many of you watching this morning, medical care continues to be at the forefront of your concern, because as offices open back up or begin to lessen their restrictions due to COVID-19, I think there's still a lot of confusion for people about where to turn, what is open again, and what really is the safe protocol. So we're so happy this morning to have Dr. John Gwynn join us. He is with the Wound Healing Center at CHI Memorial. Great to see you this morning. One of the early conversations that really has not let up since March, when we began our shutdown with COVID, is the concern about people who have other health conditions beyond the fear of catching the virus. What do you do to take care of patients with their already needed conditions? So at the Wound Healing Center, did you shut down for a while, or have you always been open?
Well, we have never really completely shut down. Our patients have problems that are fairly serious and certainly pose a risk to life and loss of limb. So we have mindfully kept things going during the pandemic.
I'm sorry, I lost you for just a second.
Well, we did reduce some of our services. For example, we do hyperbaric therapy, and that's a matter of putting people in chambers for high pressures of oxygen on a daily basis, and we felt it would be safer to delay some of those treatments because the exposure was so much in the early days. So we have reinstituted that with appropriate safeguards.
Talk to me a little bit about those hyperbaric chambers, because people have become pretty aware of their healing benefits over the last couple of years, but how do they work exactly? And if you are a claustrophobic person, are they a good idea for you?
Well, they certainly can be. So the benefit is that patients are exposed to high levels of oxygen at high pressures. And what that does is serves to increase the oxygen levels in the tissue, but it also does other things, such as to stimulate the growth of new blood vessels and to actually enhance the activity of a patient's own healing cells. Now, our chambers are little chambers, but they have clear covers so people can see it up. They have near constant communication with our staff, and most people, even if they're a little anxious, we're able to get them through the treatments well.
So who are you seeing use them the most? Is it diabetic patients? Do people with vascular issues use these? Who uses the chambers?
So a lot of our patients are diabetic patients, because we've shown that patients with certain degrees of ulcers on their feet certainly benefit. The other with certain kinds of vascular problems that we treat. We have treat patients who have wounds that are related to radiation therapy. Those specifically seem to benefit from the hyperbaric treatments. And then certain kinds of patients with chronic bone infections benefit.
So at the Wound Healing Center, are the hyperbaric chambers the only service that you provide, or are there other types of wound healing as well?
No, we provide a full assessment of the patient. Actually, our activity involves evaluating patients in the wound center by our team, which includes the nurses and physicians. And so what we actually do is assess the wound, we assess the patient's overall health status, coordinate their care with their primary physician, with vascular surgery, with infectious disease, and we also do certain procedures in the Wound Healing Center, such as what we call the debridements, which is where we remove dead tissue and infected tissue from wounds. And also we're in a position where we can apply advanced healing products, what we call skin substitutes, which can help wounds heal up completely.
So I would imagine that most people who are diabetic, for example, know that this potential for unhealing wounds comes with their diagnosis, and so they're watchful for it. But how much do these patients rely on friends and family to let them know when there is a wound? Isn't that part of the concern, that they don't even know sometimes when something is not healing?
That's correct. So many patients with diabetes have what we call a neuropathy, so they don't actually sense the bottoms of their feet very well. That's it. Number one, gets them into trouble when they develop a wound and they don't know it's there. And so sometimes it is a family member or their provider who actually sees the wound. Or unfortunately, sometimes when it progresses to a point where it's infected, they actually seek medical. And so that's one of the things we teach for prevention and for reducing, is to sort of pay a little bit more attention to the bottoms of those feet, even with mirrors and other things on a daily basis.
We are seeing people, as you well know, who are concerned about COVID-19 in varying degrees. So some people are very, very cautious. Other people are saying, you know what, I'm going to take my chances. With your demographic that you're seeing, though, at the Wound Healing Center, I'm assuming that they're in a little bit of a compromised situation health-wise. So I'm guessing you're taking a lot of precautions.
Oh, absolutely, and they are at elevated risk. And of course, our policies are that all of our staff are screened for symptoms and fever and things like that on a daily basis. We also wear masks. I took mine off for the interview, but we're typically wearing them all the time around the center. Hand washing has always been a part of our practice, but it's even more so. The patients themselves are screened via a questionnaire, and we have arranged our scheduling so that they come in and really have almost no contact, for example, with other patients in a waiting room. The waiting is very minimal, and they're spread apart so that there's not a lot of interaction with other patients.
And can you come in with a family member, or is it just the patient allowed in?
Now we like to just have the patient, but there's certain times when family members are really critical to the care of the patients, to help with understanding what's going on, and also to help with teaching for what needs to happen later. Mm-hmm. So again, those selected people are go through the same screening process and protective measures come back with them.
Well, you were very good to share some time with us this morning, and I'm so glad that you've been able to find a way to adjust to these circumstances and continue to give the care that people need.
I'm happy to do so, and we're glad to be here on the air.
Great to see you, Dr. Gwynn. Have a great rest of your day.
You too.
You can catch up with Dr. Gwynn and the rest of the staff at the Wound Healing Center at CHI Memorial. Their phone number, 495-HEAL. That's 495-4325. Online at simplymemorial.org/wound. We're back with more 3+U right after this.